A question that I was recently asked about regarding ketamine was, what is the difference between recreational ketamine use and medical ketamine use? So to answer that question, there's several major differences. The first one is the quality of the ketamine. So if someone is getting ketamine on the street, who knows what it could be laced with, whether it's cocaine, methamphetamine, fentanyl, it's unknown. But if you get it from the doctor's office, it's going to come from the pharmacy, it's going to be regulated by the DEA, it's going to be very safe. Also, when you're receiving ketamine at a ketamine clinic, typically the doctors are monitoring your vital signs like your heart rate, your oxygen level, your respiratory rate, and your blood pressure. In a recreational setting, it is not monitored at all. And ketamine is a great drug, but it is important to be safe during the use of ketamine, which is why I recommend monitoring during the treatments. The other thing is the intention behind using ketamine. If someone is using it recreationally, they may be just wanting to escape what is going on in their life. However, with medical use, we have a very specific intention when we're using ketamine, and that might be to treat depression or PTSD or anxiety or chronic pain. Also, with medical ketamine use, the goal is to actually not escape from your problems, but to do a deep dive into them. We highly encourage patients feel their feelings, feel their emotions, figure out what the root cause of some of these symptoms are, and that's going to be very different from a recreational setting. Lastly, I do want to mention bioavailability. When you're receiving ketamine at a clinic, it's typically done intravenously. This means there is 100% bioavailability. If someone is doing it recreationally, it's generally done intranasally or ingested orally, and with that, there's much lower bioavailability, which means that when you're getting IV ketamine, you can use lower doses. And although ketamine is a very safe drug, at higher doses and frequent usages, it can cause problems to the bladder and liver, which is why it's important to use the minimal effective dose. Thank you for asking the ketamine-related question. And if you have a ketamine question, maybe we can answer it. So feel free to message me or leave a comment, and we just might answer that for you. Until next time.